Hi everyone, this is Dr. Vanessa Marino here. Hope you're all doing well. In this short lesson, we are going to talk about one of the easiest, most effective ways to prevent disease transmission hand hygiene. That's right. The term hand hygiene includes both hand washing with either plain soap or antimicrobial soap and use of alcohol based hand rubs that do not require the use of water. According to CDC, proper hand hygiene is essential for healthcare professionals. It is the single most important practice to reduce the transmission of infections in healthcare settings. Hand hygiene protects both healthcare personnel and patients by reducing the spread of deadly germs, including those resistant to antibiotics. It also lowers the risk of healthcare associated infections. Why hand hygiene matters in dentistry? Because improper hand hygiene can contribute to the spread of blood-borne pathogens, respiratory microorganisms, bacteria present in the oral cavity, and viruses such as influenza or the common cold. The question is, when should dental health care professionals wash their hands? Let's go over the next slides so you can see different scenarios. You should wash your hands before and after each patient, before putting on and immediately after removing your gloves, whenever your hands are visibly soiled, after touching contaminated surfaces with your bare hands, such as touched instruments, materials, and equipment likely to be contaminated by blood, saliva, or respiratory secretions. After removing your PPE, after you reglove or remove gloves that are torn, cut, or punctured, before leaving the dental operatory, after any contact with bodily fluids, even if gloves were worn. In this picture, you can see me and my dental assistant in the middle of a periodontal surgery. As you can imagine, procedures like this involve exposure to blood and other bodily fluids. So following proper precautions to prevent blood-borne pathogen transmission is absolutely essential. Before touching your face. Now, do you know how often we touch our faces? Do you have an idea? You can pause the video here and think about the answer before moving forward. On average, people touch their faces 15 to 23 times per hour. Many of those touches involve the eyes, nose, or mouth, which are key entry points for germs. That number actually comes from real observational studies, including one where researchers watched medical students during class and counted every touch. That same study also noted that 44% of touches involve mucous membranes. In a more recent systematic review, the pooled average of facial self-touch specific to the T-zone, eyes, nose, mouth, and chin, was 68 times per hour. Why this matters in dentistry? Because the T-zone is the exact area where microorganisms, including viruses and bacteria, can enter your body. And definitely wash your hands before eating and after using the restroom. Now that we understand the importance of hand hygiene, let's go over the proper technique. First things first, before you wash your hands, make sure to take off any jewelry or wristwatches. Then open the faucet and get your hands wet. Make sure to get enough soap, and you want to lather your hands and your wrists with the soap and make sure all hand surfaces are covered. Scrub all surfaces of your hands. Ideally, this whole process should take at least 20 seconds. An easy way to get your 20 seconds in is by humming or singing Happy Birthday twice. You want to start with the palm of your hands, rubbing them together by using a circular motion. Then we'll move to the back of your hands. Rub the palm over the back of the other hand with interlaced fingers and do that for both hands. Next, scrub in between your fingers, palm to palm. Rub your hands with fingers interlaced. After that, clean under the nails by using rotational rubbing backwards and forward motion with clasped fingers of the right hand in the left palm, and repeat the same for the other hand. A little reminder here. Keep your fingernail tips trimmed to about 1/4 of an inch, and they should be neatly filed with no sharp edges. The thumbs. Clean your thumbs by grasping your thumb with the opposing palm. Do that with rotational rubbing of the left thumb clasped in the right palm. Then repeat the same process on the other thumb. Last, we'll clean the wrists. Rub each wrist with the opposite hand. Then rinse thoroughly under running water until all soap is removed, making sure the water runs from the wrist to the fingertips to prevent recontamination. Throughout the cleaning, your hands and wrists should be lower than your elbows. Finally, dry your hands with a disposable paper towel and be sure they are totally dry. And just like that, now you're equipped with one of the most powerful tools in infection control: clean, confident hands. Now, when using alcohol-based hand rubs for hand hygiene, you want to start by putting enough product into the palm of one hand and rub hands together, covering all surfaces until dry. If your hands feel dry after only 10 to 15 seconds, that usually means you didn't use enough product. Remember, gloves alone aren't enough. Clean hands protect our patients, our team, and ourselves. Great infection control starts with small, consistent actions. Hand hygiene is the one that sets the standard. In your next clinical session, pay attention to your hand hygiene technique and see if you're hitting all the steps. Thanks for watching, and I'll see you next time.